Hi there, I'm Dr. Chung and I am your friendly proctologist. Welcome to the community and thank you for being here. The community has been growing so fast and so strong. It's been an amazing ride, but let's help spread the word out to other sufferers just like ourselves. So please like the video and subscribe. Today I want to talk to you about some shocking truths that I've been learning myself about anal fissures. Okay, this stuff is not in the textbooks. Where did it come from? No, I didn't just dream about it. I talked to my patients, and this is the data I've been collecting and really learning about what's been most effective when treating my patients. I think it comes from the ideas, the principles, the strategies. That's got to be established first, then the therapy comes right behind it. And it's been interesting to learn so much about this, learn more than what my textbooks have offered me. And what did I have to do? I just had to listen to my patients. Anyway, medicine has been super cool, and I hope that I keep learning so I can bring you more helpful info. Okay, so there's going to be a series of 4 shocking statements or 4 shocking truths that I've learned. Let's get on with it. Shocking truth number 1 is that it is okay to get anal fissures once in a while. Yeah, anal fissures are not a marker of death. Death. They are not a marker of disease. Everybody, the normal body, gets them, okay? They are simply a cut inside the lining of the anus. And you know what? Where else we get cuts? On our arms, on our face. And our body reacts to all of them the same way. It wants to heal them, lay down the scar tissue, seal the wounds up so that you can start doing things like poop again normally. Unlike what the internet tells you, the vast majority of anal fissures are not because of cancer, okay? So don't think that 100%,
oh, I got an anal fissure, I must have anal cancer.
okay, that's not the thought process that should be going through your head. In fact, I would rather you think, there's something here, something's annoying me, I should get checked out. Yes, I'm nervous about it, but I don't want this to take over my psyche and get depressed about it. I'm gonna do something about it. I'm gonna take action and get it evaluated. But I know that the very likelihood of this being something life-threatening is very, very small. Anal fissures can be super irritating with that itching and the swelling going on there, right? And so I think my lucky stars that I found Revival XR. This has been an awesome supplement because I only need to put one thing in my bathtub when I feel that swelling and that spasming going on, okay? This has been very helpful to get my muscles to relax. It's got all the necessary ingredients. It has your salt in it, it's got your oils, it's got your natural herbs, 20 in all, okay? And then you've got the smells that come along with this therapy, the aromatherapy. And best of all, it's on Amazon. And even better of all, it's got a coupon. Just click it down below, put in Dr. Chung, and to get a nice discount on it. Thank you so much to Revival XR and bringing this to my health and bringing the coupon over to us. Give them a shot. I think you're gonna really like it. Now back onto the video. Shocking truth number 2 is that if you've had an anal fissure before in the past, you're gonna get it again later on, okay? And that's probably not a surprise to you because you probably have lived through that many times already. But I will tell you that it is normal for these fissures to come back. Why? Because after a cut is first formed, again, like I said, the immune system puts down scar tissue, but that scar tissue is not the same strength as your original equipment that you were born with. That's right, it's actually much weaker. So if you think about the anus, which is a circle and it has to stretch open every time you poop, if you stretch that too far, that scar tissue is the weakest link and it's gonna snap open first. Or if you just healed it and then you had a rough poop rub up against that fissure or scar, yeah, that's what's gonna go first. But the beauty here is that if you have a good routine, you know what is causing your fissures and you know how to heal them quickly, it actually goes away quite quickly. The only time it's a problem is when the fissure doesn't go away quickly. You're stuck with it. It starts to get worse. It turns into a chronic anal fissure. And that's where definitely you want to get evaluation and be seen so that you can quickly get this wound healed. And yes, getting a fissure over and over again, no matter what the frequency, whether it's once a quarter or once a week, is super annoying for sure. I know when I get my fissure, it's like, oh, dang it, there it goes again.
Dang it!
But once you develop some confidence in your lifestyle and your routine that you built to try and combat these fissures in the first place, the routine will take care of that anal fissure itself, and you just have to leave it on autopilot and things will get back into place quickly. The next shocking truth is that you may have thought your fissure completely healed, but in actuality, it hadn't healed at all. So there are some people that when they get the fissure flare, it's really, really severe symptoms. Or there's people that get symptoms of the fissure maybe pretty often, maybe once every 2 weeks or something like that. And the thing is, before the flare, the patient will say that
I have had no pain, no bleeding, everything is completely smooth, and then all of a sudden I get one poop and the fissure symptoms are all back again.
when I examine them in my office, what will I find? I will see that there is this really deep cut in their anus. There is muscle fibers of the anal sphincter just staring at me in the face because the cut is so deep, okay? And the skin edges at the edge of the canyon where the cut is, they're like piled up kind of high, and they may even be a little bit rubbery. And those are all signs, examples of how I know a fissure has been there for a long time, okay? So it is impossible that you've actually healed it in the meantime. Those kind of changes, sometimes they've been there for 6 months in a row, or the fissure's been there for longer than a year. That's the kind of changes that I see typically. And of course, it's super disappointing to hear something like that because he or she may have had a ton of lifestyle changes to make things so that they don't have pain or bleeding again. And so they must be on the right track, right? But what's actually happening is that, yes, those things are helpful, okay? Don't stop doing them necessarily, but it may not be enough, okay? There may be a link that's maybe missing to completely heal the entire cut. Last but not least, shocking truth number 4 is that anal fissures are actually a symptom. They are not the core problem. Okay, you go to your doctor's office, they see your fissure. What do they want to do? They want to heal the cut. That is the objective. So of course they'll give you the creams, they'll tell you to take tons of fiber so that you can heal this cut. And they say if you heal it, you're all good. But what happens to a lot of people? They either don't improve, it doesn't seem to get better, or if they get improvement, the fissure may come back every 2 weeks, every 4 weeks, enough where it's like, what the heck? Why isn't this stuff making the fissure stay away? And in my opinion, it's because you have not addressed the main core problem. It's like you got a mole in your backyard who keeps burrowing holes there, and you're just trying to cover up the holes with more dirt when in fact you should be trapping the mole so that your plants all don't die. In my opinion, it is absolutely a-okay if the fissure does not heal up right away, because that's not the main objective. I know that fissures can come and go whenever they please, however random they are. I want to focus on the main problem. And what is that? It is the internal anal sphincter and pelvic floor muscle spasm. These muscles have been injured over time, they're tired out, and they're squeezing way too dang hard. They have forgotten how to relax. They are causing you to poop with bad habits and with tight anuses that, hey, how did you not expect a cut to not reopen? How can you expect a cut to heal when there's poop scraping along inside your anus when the poop is coming out? It's impossible. The anus is way too fragile for that kind of abuse. And yeah, that is why I am not bothered with cuts in the anus. Do we want to heal the fissure? Oh, absolutely, that is a goal. But in my opinion, once you get started with some physical therapy to teach your anus to relax those muscles, rehabilitate, strengthen those muscles again to their original health, then yes, the anus will start relaxing more, chilling out, not squeezing when you're pooping. And guess what? Those fissures will finally see the right conditions and absolutely heal on their own. Do you need soft poop? Will those creams help? Yeah, I think they definitely can. But is that all that you should be doing? Is that all people need to heal it? No, absolutely not. There are many people where the creams don't help. And then what happens? The sad thing is that many people get recommended to do the sphincterotomy, where the internal sphincter muscle is cut permanently. Where in my opinion, I don't think that's even the right therapy. That's not the right first recommendation. I think that kind of surgery should be a last resort when everything has failed and the patient is going crazy nuts because nothing else has worked. And it does not have to be said. You and I both know how much fissures suck, okay? It sucks! They destroy activities we love, the foods that we love, but it's been truly amazing to really relearn what I know and challenge what I know about anal fissures, because it's completely revolutionized the way I treat them, how I treat people, and I've seen a ton of success. Definitely check out pelvic floor physical therapy for your anal fissures. See what other types of professionals are seeing about your conditions. Get evaluated, and I think it could be massively helpful, especially if you've got some spasm issues going along with it. And so with that, I hope that this video has been helpful for you to kind of challenge what you already have gathered from the internet and what you learned from your doctors to see if there's some gaps that can be filled with this knowledge. And so I want to give a shout out to Revival XR one more time here before we go, because they have been an incredible tool for me when I do my sitz baths. You know, when I get my fissures, when my hemorrhoids are spasming and creating that swelling, this is what I'm using in the sitz bathtub, okay? Or my bathtub, because I don't use those plastic hats, okay? And the scent is very pleasing, very subtle, and this comprehensive. You know, why not just use one tool for the job? Completely natural and organic ingredients. Definitely give it a shot. In the description, there's a coupon. Definitely use it. I wish you well. You take care. Bye-bye.